Thank you for joining us today. World Mental Health Day is observed every year on 10th October. The theme for this year is Make Mental Health and Well-Being for All a Global Priority. My name is Hannah, and with me on the show today, I'm joined by doctors from Bangalore Baptist Hospital. Dr. Darlene Dakar, thank you for joining us. Dr. Darlin has 9 years of experience as a psychiatrist and is an expert in the consultation and management of mental health issues. Dr. Darlin has a special interest in community psychiatry and psychosocial rehabilitation. Prior to joining the Baptist Hospital, Dr. Darlin was the Christian Medical College Fellow as a tutor in their Department of Psychiatry, Psychosocial Rehabilitation Unit. We also have Dr. Preeti Nainan. Thank you for joining us. Dr. Preeti Nainan has completed her MPhil and PhD in clinical psychology from NIMHANS, Bangalore. During the course of her PhD, she worked with children and adolescents in the clinical setting and carried out research on group therapy for adolescents with emotional problems. She has previously served as a faculty of psychology at an undergraduate college for women and has qualified for UGC NET and JRF. She has 3 years of experience as a consultant clinical psychologist at Bangalore Baptist Hospital, seeing individuals across age groups for the purpose of evaluation and psychotherapy. The first question to you, Dr. Darlin. What is mental health? How does our mental health affect the way we think and our life?
So, to define mental health, according to World Health Organization, mental health is a state of well-being in which the individual realizes their potential. They are able to cope with the normal stresses of life that they encounter. They are able to work, function, be productive and fruitful in their work. And they are also able to contribute to the community. So, mental health affects the way we think, the way we feel, the way we act in various ways, and it enables us to be able to achieve achieve the goals in life, and it also enables us to face challenges. So, mental health is not only the absence of like mental illness or mental disorder. We all have mental health, and if we look at it in the form of being on a spectrum or a continuum, in that and on that continuum, there will be times when we experience, let us say, changes in how our mood is. Sometimes our levels of anxiety can vary, and this can vary along that spectrum, where it can be sometimes more or sometimes less, and it can also depend on what is going on, what in our lives at that point of time, or the support that we have. So it can vary from where we can be like, let us say, healthy, or it can also lead to states where there can be mild to moderate or even to severe conditions, and this can result in various conditions of mental illness.
Dr. Preeti, when can we say that a person is mentally healthy?
So, there are various characteristics or indicators of a person who is emotionally healthy, who is mentally healthy, or we could say emotionally well adjusted. So, one of these core characteristics would be a person who is able to distinguish between what is real and what is not real in the world around him. So, for example, a person might be thinking that everyone's out to get him, everyone's plotting against him or conspiring against him, even though those around him in his community know that that's not the case. And so that would be an indicator of a person who is not emotionally healthy. Another characteristic would be of an emotionally adjusted person would be a person who is able to purposefully set goals and then work towards these goals in a productive, goal-oriented way, all the while being conscious of their motives and in their intentions in working towards that goal. A person who is emotionally healthy also has voluntary control over their behavior. So if they know that they are not on the right path, they are able to exercise voluntary control to then change the path of their behavior as well. Another characteristic would be a person who is able to form relationships and also sustain these relationships, whether with family members, whether with colleagues, whether with friends, whether with others in the community, right? And being able to do this very consciously and intentionally, that's also important, right? Another very important indicator of someone who's emotionally healthy is that they should have adequate awareness about themselves and adequate self-esteem, right? And if they have problems, they're able to deal with the day-to-day stresses that all of us face, right? The frustrations and the stress of life, being able to deal with that, tolerate that, and approach that in a very problem-focused way without avoiding these problems. So I think those are some of the chief characteristics.
Dr. Darlin, does my physical health affect my mental health? If so, how?
Yeah, that's a very important question. Yes. So, uh, mm, uh, mental health is as important as physical health, and we hear the saying, "A healthy mind is a healthy body," and so physical health and mental health. Uh, Physical health does affect the mental health, as well as vice versa also. So if we look at certain health conditions, if we look at like non-communicable diseases, that is diseases where there is no acute infection, but it results in a lot of long-term health problems that also requires long care and treatment. And taking examples of those like cardiovascular diseases, diabetes, or chronic lung diseases. So, if we to demonstrate that, through example, let's say a person who has diabetes, been diagnosed with diabetes for the last 20 years, and has been on treatment over the years, and it can, at a certain point of time, let's say the person starts not following the treatment very regularly, skips the medication, may not be very careful with the dietary regulations that they have been advised, and exercise routine is not well maintained, and so that can lead to where there is complications of the illness. In those situations, we also encounter that, because why is it that this is happening? Earlier they were able to, and along with that, let's say that the individual has also been feeling very low, has not been like not, so that interest and motivation has also been like reducing. So and those can be associated with problems in their mental health, which is resulting the complications in their physical health. And non-communicable diseases result which in almost 41 million of deaths per year, and most of these conditions are preventable. Similarly, if we look at the role of stress, so stress is a response of the brain and the body to any demands. The demands can be work, busy schedule, it can be, let us say, academics and studies and exams. It can be any major life changes in a person's life, or it can be any traumatic events also. So the stress manifests in various physical phenomena, and which results in like a cascade of changes that are there. If we look at, so it begins with where the brain, in the part of the brain that sets off the alarm, like an alarm, and that sets off the stress response. When that happens, what also results is that there is other regions of the brain which results in, let's say, certain stress in inducing hormones that are there, and these can result in the body being prepared in such a way which is like the situation of fight or flight. And then following that, it continues where the memory center that controls the memory also has the influence where the experiences, past experiences, or other things that have been experienced, it influences maybe at that point of time how these had been encountered and respond to that. And finally, it results in where that means the part of the brain which has got all this information and in how it is responding to stress. So the response can be sometimes either like within a short period of time, or it can be all these which have been going on for a long time, and that can also have a lot of impact on various health conditions.
Dr. Preeti, what are the factors that contribute to a breakdown in mental health?
Sure. So when we often see a person who comes before us with a mental health difficulty, we know that there are a complex contribution of various factors that are leading to the current difficulties. And so sometimes it's good for us to understand all those factors that could lead to the present condition. So first and foremost, we have to understand that at times there are factors that are not obvious or immediately apparent, and they are factors that may have been playing a role over a long period of time. They are factors that we refer to as predisposing factors, factors that create a vulnerability in that person to develop a mental health issue at a later point in time. So one example of that would be having a family history of a mental health issue or for mental illness. So if an individual has a close family member who has had depression, then there's a higher chance that he himself might have depression at a later point in time because of a genetic risk or a predisposition. Another predispository factor is, let's say, having a medical illness at an early point in time. And another risk factor is, for example, having a very negative or traumatic experience at those early years of life. So we know that the early critical years of life, the formative years of life, are very important as a foundation for the rest of your life. And having a very adverse experience in childhood, like losing a parent, could sometimes set a stage for developing a mental illness at a later point in time. And we might see that happening many years later. So those are those predisposing factors. But many times when we see a person sitting before us with a mental health difficulty, it's because they've just experienced certain traumatic or triggering events, what we term as precipitating events, something that's precipitated this present crisis, right? So an example of that would be, a kid who has experienced severe bullying in school, right? Or someone who's recently been given a diagnosis of a medical illness, which is very earth-shattering for them, right? Or many other things. Now we know that the recent pandemic was so triggering for so many people. It brought in so many experiences like loss of loved ones, right? Loss of a job and therefore your financial livelihood, right? For children, it brought in loss of contact with loved ones and friends and school and routine. And many of these might trigger off mental health illnesses, right? And so those are the experiences that the person might report to you that has just happened. Things that have been extremely traumatic for them. Having understood that, we know that there are also factors which tend to maintain or tend to worsen the mental health condition. They may not have caused the issue, but they kind of worsen it. And until we take care of those, things are not going to improve, right? So for example, having an unsupportive family environment, right? Or not having the financial resources to take mental health care. They could be factors that worsen the illness rather than helping the person improve. As compared to, let's say, another, maybe a child who has a supportive family, who has the resources to get the help for him that he needs, right? And that child is likely to do a lot better, right? So just keeping in mind maybe a recent, maybe a representative case of many of the cases that we're seeing, right? A young adolescent girl who also has a family history. Like I was talking about the predisposing factors, her mum was also diagnosed with depression many years in the past and has been on treatment for depression. But this young girl, with the onset of the pandemic and online classes, right, lost contact with a lot of the friends and the routine that she was used to, and began to, fare less and less well with regard to academics. And by the time regular um, physical life had started, she was ready to transition to college, and it was a huge shock for her, and it began to manifest as depression. And I talked about factors that maintain this, and one of those factors that maintaining it for her is the high expectations from her family that she should just be able to go back and resume life like nothing's happened, right? And so we know that that's kind of worsening this the mental health condition that she's facing. So why is it important for us to understand these factors? Some of these factors we may not be able to do much about, like the genetic factors or the underlying factors, but it helps us to understand why this particular person has come before us today. But some of these factors we can address, and we do address through a mental health care, right? And the person being able to take an active role in dealing with their mental health is able to change some of these factors and evolve into a better person after the illness.
Okay. So, Dr. Darlin, at what point should a person consider seeing a psychiatrist?
Yes. So, um, yes, when we think about, at what point that they should see, now, uh, many many people, like, let's say, who experience difficulties, and so sometimes, either it can be like a situation where uh, they're not sure, like, who to see, who to consult with. Sometimes they may be thinking that, okay, this will go away, it's there for some time, and after that it's not there anymore, so I'm okay now, there's no need anymore. Or at times they may be like, in some of the conditions where, let's say, what they experience and how their thoughts are so disturbing that they may also feel embarrassed, maybe, to how do I talk to someone. What if I'm being judged, by telling about these things and all that, even they know that it is like so unacceptable. So um, but also, it is important that, if let's say somebody is able to recognize that it can be either the family members, or it could be close friends, or even colleagues and all that, um, who the person with the problem is going through a difficult time, and they can also reach out to them and, like, talk to them, where they can bring them and say that, yes, we feel that, this is required, and that they can seek the help and treatment. So uh, situations where there is a marked change in behavior, either it can be like, very different from what they used to be, how they used to feel, or it could be extremes in how they like, change in the behavior totally. Somebody who's uh, and that is very, let us say, very obvious, and it is which even others around them are noticing it very much. Or if there is any like difficulty that they're experiencing. Also, the fact that if they are finding it very distressed to be, like, to feel that way, to experience these situations that they are in, or how they are feeling, and also if there is any change, let us in their functioning, so it causes an interference in their life. Maybe it can cause, where they're not able to do their routine work, or just going to work can become like a very it's causing a significant dysfunction in their lives. The other important point, like, when for them to seek help, it is also if there is any risk of harm. So that means there is a danger. Either the danger can be where there is a risk of harm to themselves, or like, let us say, they are experiencing thoughts of ending their lives, or they are feeling like, not wanting to continue in life anymore, or if there is also a risk of harm to others, which can be like, there can be aggression, there can be behave, which is causing like disruption in the family life and so on.
Doctor, you mentioned about marked significant changes in their behavior. Could you mention some examples, like what are those things that we can identify?
Yes. So, different mental illnesses have various symptoms. Those marked changes in behavior, it's like where Dr. Preeti had mentioned, like in the beginning of about how these can affect the, like how their thought process can be different, and it can be experiences where, let's say, they feel that like somebody is following them, or it can be as let's say maybe different as where they feel that they are being followed, tracked through a device, or and for them that becomes the reality. For someone's after them when nobody's, yes, that is there. Or also experiences like they may experience like hearing. So with that situation, they may hear like experience hearing things where somebody is threatening them, or they can hear various others, like if they, like, people are talking about them and discussing about them. So, and they may respond to those where the behavior change that is observed, that means by others, would be they find that they are muttering, murmuring by themselves, or they may be laughing, which they find that it's not the usual in that person, and these things that have developed. Yes. So to add on to that, also if we like see a person, let's say, who has been feeling low, feeling dull, and the changes that is happening is that they are losing interest. Like earlier, they used to like to read, they used to like to meet their friends, go out, and slowly they're becoming like very isolated, very withdrawn. There could also be changes in their um, other changes that can happen. They can be having difficulties like with sleep, they're not able to sleep properly, or there are changes in their appetite. Sometimes it can result where they lose appetite significant, over a period of time, and in some they can even present with significant weight loss, and they may have like a checkup to see why the weight loss, and they may even go for that reason specifically, but it may also, which investigations on all will show that there is nothing wrong, but it is related with these other symptoms that they have been experiencing. And that can also result where, let's say, they lose concentration, focus. So if it is a young individual student, so their academics may decline, or if it is a person who's working, then they are not able to concentrate in their work. So these are the various changes that we can observe, that we can see.
Thank you, Doctor. Dr. Preeti, how can an individual improve their mental health or maintain a good mental health in their life?
Okay. So I think that's an extremely relevant question for you, for me, for all of us, right? We all know that we take care of our physical health automatically, sometimes subconsciously. We just do it. We know we have to drink enough water. We know we have to sleep enough hours to be able to get up the next day and go to work, right? We know that we have dental hygiene habits. We've got to take care of our teeth, right? So in a similar way, there are a lot of things that we could do to maintain a good mental well-being, or what we term as self-care or mental hygiene habits. I think one important thing would be, Dr. Darlin had highlighted the link between physical health and mental health. A healthy body, a healthy mind. So one of the important things to do would be to ensure a good physical health routine, right? In terms of being able to, first of all, eat well, eat healthily, eat regularly, eat well. to be able to sleep regularly, because we all know what it is like after 3 hours of sleep continuously and how that affects our mood and our well-being. So being able to sleep regularly in terms of our regular sleep schedules and with a good and adequate amount of sleep. Similarly, being able to exercise regularly, right? This is important not just for physical health, but even emotionally. It puts us all into a better state of mind to be able to, exercise regularly, and also to avoid substances that affect the body and the mind. When we talk about alcohol, we talk about drugs that alter the mind as well, right? And to be able to avoid such things, because they have a very, very adverse and negative impact both on the health of the mind and the body. So that's another important thing. Secondly, I would say the importance of focusing on our emotions and our emotional well-being. It's important to be aware of what we are going through, to be aware and to recognize and to acknowledge our feelings at different points of time, not to hide away from it or to suppress it. So for many people, certain emotions are negative and taboo emotions. For example, people don't like feeling sad or angry and so tend to suppress it until it comes out at a later point in time in a much more negative way, right? So it's important to be aware of our emotions and then to be able to express it in a healthier way, sometimes through journaling, but most often just through talking to the people close to us and expressing it so that it's not building up inside us. Thirdly, I think it's very important for us to stay connected to people around us, because we know that a major risk factor for mental illnesses is being isolated or being lonely, right? And so it's very important to stay connected to family, to friends, to community, to colleagues outside, reaching out to them if we have difficulties, but also being there for them in their times of need, because that gives us a sense of meaning and purpose as well. Fourthly, to be able to bring a balance in our life. We've all heard the term work-life balance and many other terms like this, but we know we have different roles in our lives, in our family, at work, and in our community as well. And it's important to balance out these responsibilities along with our own needs for emotional well-being. So taking time out for yourself in your busy schedule to focus on your own hobbies and interests, the things that relax you, the things that make you feel happy or at peace, is also very important. So those are just a few, important guidelines. But the point is that many times, despite all of this, we might still experience a mental health issue. And so it's important that if we reach that point, we should know that we can reach out to someone who can help us. It could be a trusted person, it could be a counselor, it could be a psychiatrist, but we can know that at times we do need that extra help and we can take care of our mental health in that way as well.
So we have come to the end of our show. Dr. Darlin and Dr. Preeti, as we conclude, why do you think it is important to be more aware of mental health issues?
Yes, so I just want to highlight, the point here that mental illness is the most stigmatized health condition, and people who face that stigma, they also face a lot of barriers, a lot of challenges in, for them being able to achieve or to even get the help that they need. And if we think of let's say uh, so in mental illness, it is not something that we can see or that it's not tangible. So we can't do a scan, or we can't take an x-ray, or we can't even check a blood test to diagnose mental illness. And what is what happens is that it is the thought that mental illness is not is not there, and that it is not something that it is real. So and so that means that situation must not be real if we can't see, and if we can't this has led to a lot of misunderstanding, and the misunderstanding in where the thought is that, so a person can control it. If they are behaving differently, they should be able to control it. Or if they are, let's say, being low or being down, they should just snap out of it. But it doesn't happen that way. But the important point is that if people seek treatment and mental health care and treatment, then there is an improvement in how they feel and in how they behave and how they are, as well as improvement in their symptoms, where they can be able to achieve a healthy life.
Yeah. And just adding on to what Dr. Darlin was saying, because there is so much stigma and discrimination regarding mental health, often the people who need mental health care do not get it, right? And that's the sad reality, not just here, all across the world. That's why we celebrate World Mental Health Day every year. Like you had mentioned, October 10th is celebrated as World Mental Health Day globally, right? And the effort in celebrating World Mental Health Day is to be able to draw attention to the fact that mental health issues do exist, that they are legitimate, that everyone deserves the right to take care of their mental health and to take treatment if they have mental health issues. So this year's theme is making mental health and well-being for all a global priority, which means all should have equal access, to care. So what that means for all of us is that, we have a right to take care of our own mental health and well-being. Taking care of your mental health is not being selfish, it's a necessity. And also, if anyone comes across someone in their circle of acquaintances who they understand is going through mental health difficulties, it's important to be sensitive to these issues, to be there for that person in a sensitive and caring way, and also, if possible, to get them the help that they need in getting them the access to the mental health care.
Thank you so much, Dr. Darlin, Dr. Preeti, for talking about this subject, for helping our viewers and our listeners to understand and bring awareness to this subject. Thank you so much for taking time off your busy schedule and being here on this show today. Thank you.
Thank you so much.
So if you want to reach out to us, please call us at +91 6364 252164 or email at info@febaonline.org. Let's make mental health and well-being a priority. God bless.